So there's a couple things to understand about variants. One is that viruses will always mutate. I mean, look at the influenza virus, it mutates every year. That's why every year we talk about whether or not the vaccine is working or not working. Every year there's a slight change and that we adjust our vaccine for. Every maybe 100 years, you get a big change that's called a shift. And that's why you got, like, in 1918, you had that big influenza, what they call the Spanish flu outbreak. So it may be that every 100 years we'll have a big COVID outbreak, but coronaviruses have been around forever, and they will continue to be around forever. And as we build up our immunity, there'll be less and less of an issue. So if you've had one Omicron variant, if you get another one, you're likely not going to have a problem with it. Both of these Omicron variants are more transmissible than the prior variant, which was the Delta variant. So it spreads much more quickly. But the really interesting thing about it is that it tends not to go into the lower airways. It tends to stay up in the upper airways. So it presents more like a cold and less like the pneumonia. So it's actually less severe. So even though people worry about it and it's more transmissible, there may be more cases, it's a much less severe, which overall is a good thing.